sharing the results of your NHS staff survey, have you ever heard, it's not fair to compare us with the whole of the rest of the NHS? Different organisations have different challenges. Only negative people ever fill out the survey. Other data contradicts what is being said by staff. How can my response be confidential? You will hear answers to all those questions and learn more about the NHS Staff Survey 2020 in this video. But first, what is the NHS Staff Survey? Well, it is one of the largest workforce surveys in the world, which has been conducted annually since 2003. Well over 1 million staff members are invited to take part and provide feedback about their experiences of working for their respective NHS organisations. The survey provides essential and powerful information to employers and national stakeholders about staff experience across the NHS in England. The survey is commissioned by NHS England. They have appointed a survey coordination centre, which is currently based at Picker, to manage and oversee the survey process throughout England. The survey is then administered on behalf of NHS organisations by approved contractors, of which Picker is one. The NHS Staff Survey is developed and founded upon the NHS Constitution and directly measures many of the pledges that this makes to staff, including that staff have clear understanding of roles and responsibilities and find their roles rewarding, that all staff have personal development plans, support and access to appropriate training, that their health and well-being is supported, and that they are actively engaged in decisions that affect them. Every year, the NHS Staff Survey surveys staff employed on the 1st of September. It has a flexible methodology, being both online and available in paper format. The sample size is directed by individual organisations. Some choose to survey a sample of staff, whereas others conduct a full census. However, in 2020, the NHS has experienced a year like never before. It has certainly not been business as usual. Now, maybe more than ever, it is important to ask and act upon feedback from staff experience. On top of the standard items in the core questionnaire, a COVID-specific module has been added, asking staff about their experiences of working through the pandemic. What worked well, and where could we do to learn lessons? As always, there are a number of optional additional modules, and some organisations have also chosen to include their own local questions. Let's focus on some of those key questions that were asked at the beginning of this presentation. It's not fair to compare us with the whole of the rest of the NHS. Different organisations have different challenges. Well, in all final reports, whether these be your NHS England or your Picker contractor reports, we only make comparisons between your organisation and similar organisations. i.e., if your organisation is a mental health trust, you will only be compared to other mental health trusts. We hear these two a lot. This is just another reason why we offer your results in comparison both historically and compared to other organisations. If you see differences, you need to consider, why did the negative or positive people fill it in this year, but not last year? Why did the negative positive people fill it in for your trust, but not other similar organisations? It just wouldn't be the case. There must be something going on that is different. Sometimes people find that the NHS staff survey feedback is different from other sources of monitoring information. For example, maybe a low percentage of people report that they had an appraisal, but internal audits indicate that most staff did in the last year. It's important to remember that this is a staff perception study, i.e., how staff perceive their reality. Perhaps they didn't consider the short tick box exercise they did 11 months ago to be an appraisal. You will need to explore where there are any apparent inconsistencies. Dismissing staff concerns because other data suggests something will be counterproductive. More information is usually the key, not less. This has been a concern of staff since the survey's inception. We recommend that you emphasise that the survey is carried out by external approved contractors. You will never see the raw data. It is always presented in an aggregated form. It can also be useful to share the reports that you receive with staff. It's not only a great way to encourage engagement with the survey and any improvement activities, it can also demystify the reporting and demonstrate confidentiality. Thank you for listening today, and watch out for further videos on the NHS Staff Survey and organisation steps to improve staff experience. PICA is a leading international healthcare charity who carry out research to understand individuals' needs and their experiences of care. They are your partner in pursuit of the highest quality, person-centred care for all, always.